There are so many type 2 diabetes programs out there online, and many of them, or most of them, are very helpful. And they go into great detail about lifestyle changes. Some of them have specific diets that they use. It's something that I don't necessarily agree with. I think that most diets can be effective, but it's okay if they may be suggesting you use a diet that can also be effective. So type 2 diabetes programs can be very effective concerning lifestyle changes, including diet, exercise, and other aspects of lifestyle changes. However, most of those type 2 diabetes programs leave out something very important. They leave out the fact that medications are also part of type 2 diabetes programs. You may be able to go for a year or two, or perhaps even a little longer, without taking medication. And I encourage people to follow those programs during that period of time. However, if that program that you're taking leaves out the idea of medications completely, there's a subtle implication there. That implication is that if you need to take medications, you've failed. As I've mentioned before, I'm 76 years old, and I've had type 2 diabetes for 39 years. For many years, I didn't take medications, probably more than I should have. I probably should have started medication sooner. And that's probably one of the reasons why I'm encouraging you to make sure you're taking a program like mine that suggests medication if you need it. Lifestyle changes are number one. They're the most important factor and the first priority in any type 2 program. So having a diet that is helpful for type 2 diabetes is very important. I personally suggest that you can use most any diet as long as you improve that diet and make it worthy of type 2 diabetes. It can be effective. Other programs suggest they have a specific diet, and I'm not here to quarrel with that. I'm here more to quarrel with the idea of leaving out any discussion of medication. As I've said, I've had type 2 diabetes for 39 years. I understand that lifestyle changes are so important. Following a healthy diet, movement is very important. Reducing stress is very important. Getting better sleep is very important. Developing a system that's effective to maintain control of your type 2 diabetes is very important. And we have our system in our program called the Type 2 Pivot Method. It's very important, though, to make sure that you understand that there may come a time when you may need medications. And if the program that you're taking now is not discussing medications, there's a subtle implication there. And that implication is that if you need medications, you failed that program. And they may even suggest supplements. And are they suggesting supplements because they don't want you taking medications? Are they suggesting supplements because they sell the supplements? Or are they just suggesting supplements because they think they're better than medications? Medications have been researched thoroughly, and the medications that are out there now are so much more effective than the medications that have been there in the past. So I want to encourage you to continue taking the medications if you need them, but not take them if you don't need them. So I want to encourage that completely. But it's important to realize that my lifestyle medications, and I want to emphasize this so much, are the first choice. And the lifestyle changes should be emphasized at the beginning. The problem is that they should not be the end. Type 2 diabetes is a progressive disease. And there's something called beta cells. Beta cells in the pancreas produce insulin. And over time, their effectiveness is reduced. And as their effectiveness is reduced, it's harder for you to produce insulin. And the more time you go without perfect control of your type 2 diabetes, the less effective your beta cells will be. So Important reason why I want you to understand that it's important to maintain type 2 diabetes and and make sure you take medication if you need them. That's why beta cells function is very important to controlling your type 2 diabetes. As I said, the silence is deafening in many ways. The silence about talking about medications is basically, can be not only not helpful to you, but it can be dangerous. Because most of the time, in type 2 diabetes, there will come a time when you'll need medication. And the medications out there now are fabulous. Besides metformin, which is fabulous, there's Ozempic, which helps heart disease. And it also helps control your blood sugar. There's SGLT2s like Farxiga and Jardiance. They help also with kidney disease and heart disease and blood sugar. And they're very effective also. So the medications that are out there these days are so effective, and you should not reject them just because you think you should continue fighting for your non-medication, even though it's much more of a struggle to do that. These are very important qualities. It's important to realize that lifestyle always comes first. But lifestyle last is dangerous. Most of the time. That's why endocrinologists only use the word remission. They do not use the word reverse. Even though some programs use the word reverse, although they're being rejected by programs now if they continue to use the word reverse. Because you can go into remission and you can not have numbers that suggest that you have type 2 diabetes, but you're in remission because it can always come back. And that's why I suggest that medication should always be understood as an option. It's dangerous not to talk about medications. It's dangerous to consider only non-medication programs. So I want to encourage you to follow through. We have a program called the Type 2 Pivot Method. We have the morning method pivot. We have the morning method, which is also a pivot program, which discusses habits and systems that you can utilize to help protect your type 2 diabetes. So in this program, I want you to encourage you to follow through. And on the bottom here, please follow and submit so that you get on our program list and you'll get all of our videos, long and short. Thank you and have a great day.